बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लिम व सल्लि अलैहि। Dear colleagues, I am Dr. Sultan AYUB, working as a radiologist. This is the old female patient, almost 55-year age, with history of dysuria and difficult to hold the urine. So I am going to scan the pelvic region to visualize the urinary bladder. Here we can appreciate that this is the urinary bladder, and here we can appreciate the mass. This mass is hyperechoic, and it has irregular in shape with irregular border, and this is the left lateral wall, and this is the VUJ, this is the base, and this on this side is the right lateral wall. So here we can appreciate this black structure. This is the left-sided dilated ureter, and this is entering into the urinary bladder, and this is the place for VUJ, where this mass is also present. And when we appreciate the mass in such location, we should also see the uterus and the rectum for any possible metastasis or for any possible extension. And now this is the uterus, which seem to be spare, and this one is the rectum, which is also away from the mass. So get the better visualization and further detail of the mass, we should also zoom the image for further detail. So look here, this is the zoom image where we have better visualization of the mass. It has the same appearance I have already told you, and now we will see whether this lesion is aggressive or not. It is malignant or benign. So we then put the color to see any feeding vessels. Here I have seen that this color aliasing, which we see in the screen. So this zoom image with the color Doppler is not so much helpful. So okay, we then go to the detail of this mass. Look here, this is the ureter distal, and this is the VUJ, where we can also appreciate this mass. So this mass has involved this left VUJ, and this is the lateral wall. So it is also adherent to the left lateral wall. Look here, and it has irregular border. Here it has penetrated the lateral wall, and here it is not. Here also relatively sparing, but here in this area it has penetrating the left lateral wall of the urinary bladder. So then we go to the base of the urinary bladder. This is base which is spared from the mass, and this mass is extended into the lumen, floating within the lumen, and it is not going beyond the boundary of the urinary bladder. We can appreciate tiny calcification here, this one, and this one. So this mass is also having tiny calcification. However, no gross calcification is noted here. Look at the border, elevated border, then depression, and so on. So it has irregular border. It is wider than tall. So it is as width is broad than the length. And here is a base. It is touching the base, but it is not involving it. So what we have seen, this is the hyperequic mass with irregular border, irregular in shape, with major bulk into the lumen of the urinary bladder, and this mass is adherent to the left lateral wall and also involving the VUJ. Now when I have uh, off the zoom image, so then let's see the color Doppler. It is not also helpful as it is aliasing. So now this so I have changed the so which the preset which I have made in this ultrasound, I have changed the preset so that I can have better view of the vessels that would be supplying this mass. We have seen this that this is also have vascularity, and now I am going to see the so here we can appreciate that this mass has arterial supply also and venous supply, which increased diastolic flow, forward flow. So when we have seen that this mass is involving the left VUJ, we should also go to see the left kidney. This is the left kidney, and we can appreciate the hydronephrosis of the left kidney. This means that this mass is causing obstructive uropathy at the level of left VUJ, resulting in this hydronephrosis. This is the ureter. This is a ureter and it is crossing the iliac vessel at this level. This ureter is also dilated. So most likely in this age group, the most common tumor in this age group is the transitional cell carcinoma involving the left lateral wall and the left VUJ with resulting in the left sided moderate hydronephrosis and hydroureter. I have seen the liver, right kidney, and the iliac fossas on either side to see any lymph node which I could not appreciate. So, in conclusion, most likely this is a case of transitional cell carcinoma involving the left lateral wall and the left VUJ with resultant obstructive uropathy on the left side. This is the likely diagnosis. So we should go for the CT scan with IV contrast for abdomen, pelvis, and also chest also, as this tumor bladder carcinoma are culprit for metastasis to the lungs also, and also biopsy will tell which type of this tumor is. Thank you very much.